Welcome back to Hey Baby and Beyond. I'm Lauren, an antenatal and postnatal teacher here in the UK. And today I just wanted to touch again on optimising your chances of having a birth without intervention. So, obviously, the majority of people that go into labour and birth plan to give birth that is relatively low risk unless you're planning a caesarean birth. So, how can we go about this and what can we do to make this a little bit more likely to happen? So, evidence does show us that if you plan a home birth, even if you don't plan on having a home birth, you are more likely to have a birth without intervention. The reason being is that we know that if we set out to have a low risk birth, we know what we're aiming for, we know what we have to rely on, and you are more likely to get one-to-one care during labour. So even if you don't think you would like a home birth, it's really, really important to start thinking about preparing for a home birth, even if you do plan on giving birth in the hospital setting at some point. So this goes back to the whole staying at home as long as you can, making sure you're utilising your upwards, forwards and open positions, keeping yourself hydrated, making sure that you're fueling your body and going to the toilet regularly, and having a great support partner who can advocate for you as well during labour. So we know that these things are more likely to mean that you wouldn't have a birth with assistance, you wouldn't have an unplanned caesarean birth, and your change of plans wouldn't tend to happen as often if we have already set out to have a low risk birth. Lots of people are now thinking about planning a home birth and accessing the home birth team in the local area, even if their deep down thought is that they don't want a home birth. And the reason being is that once you are in established labour, your home birth team are going to stay with you then, and you're going to get continuous one-to-one care, which we know from evidence shows us that you are more likely to have less intervention. And even if at some point you choose to go to the hospital to have your baby, your midwife that's cared for you on a one-to-one basis is still going to continue to care for you during the labour in the hospital, or for a good part of it if they can do. So planning a home birth, really important, or even planning a low risk birth in a birth centre. But we do know the evidence states that planning a home birth specifically gives you more chance of having a birth without assistance. So I would really start to consider your preferences for labour and birth. If you are wanting to stay away from things like forceps, ventouse, unplanned caesarean births, then a home birth might be the thing that you need to start to consider. There are things that you can do in a home birth that can be used as pain relief, because sometimes that's what people worry about. And also knowing that if there was a concern with your baby or yourself, then there would be a transfer there waiting for you to take you to the hospital setting to be cared for in that setting if needed. So in a home birth, we can use your self-help methods, which will be really encouraged anyway, along with gas and air. So gas and air can be used when your labour's established right through to the very end. But we do know that if you're planning on using a home birth facility, so staying at home, using maybe water, you are less likely to use the gas and air in the earlier stages and to wait it out a bit longer, because you know that this is one of the things you've got to use during your labour and nothing else. It might be that you utilise it later on. So home birth midwives supporting you at home are very, very aware of physiological birth and what we can expect from a labour and birth process and how we can enhance that. So it is really something to start considering. If you're wanting to keep your birth low risk, I would look into the evidence of this a little bit further. And remember that you can change your plans and preferences for birth at any time. So even if mid-labour you decide this isn't for you and you do want to go to the hospital, then there's nothing stopping you from doing that. But if you've already planned the home birth, it means that those plans are in place ready. And even if they change to the latter, then we can go with it and go with the flow. Or you might decide, actually, I'm absolutely fine at home, I'm being well supported, I'm managing well, let's just see how it pans out. And, hopefully your baby will be born at home, where we know that you've got less chance of things like postpartum hemorrhage or third and fourth degree tears or requiring assistance after birth, we know that you're more likely to have a more positive experience. Do comment below if you've had a home birth, how did it go, or any questions that you'd like to ask about planning a home birth or home birth in general, or anything at all to do with labour and birth, and we will do videos on this or respond to you in the comments. Don't forget, subscribe to the YouTube channel. It's really, really important because you can get lots of information here in one place to support you through labour, birth, and beyond when your new baby arrives.